Deep sliding systematic palpation of the abdomen. The stomach. Perform hand washing before the contact with your patient and provide privacy. Prepare all the equipment and greet your patient. Identify your patient, take an oral informed consent, explain all the steps of the procedure to your patient. Perform hand hygiene. Manipulation can be performed with using of non-sterile gloves when it can be a risk of contact with patient's biological fluids. Ask the patient to undress to the waist. Use supine position of your patient for palpation. The room should be warm, your hands should be warm, cut your nails before procedure. The couch is pre-prepared, clean with napkins. Sit on the chair to the right side of your patient. The chair seat is at the level of the couch. The patient is lying on his back, his head is lying low on the couch, his arms are stretched out. The abdominal muscles should be relaxed and the patient's breathing should be calm, preferably with his mouth. It is necessary to determine the inferior border of the stomach by one of three methods. It can be percussion palpation, ausculta percussion, or ausculta friction, or scratch test method. When you found this inferior border of the stomach, you can palpate it. The right hand fingers are on the level of inferior border of the stomach. Your middle finger is on linea alba. The palm of the hand is facing to the umbilicus. With a superficial movement during deep inhalation with the abdomen, the fingers are displaced up and the skin fold forms in front of the fingers to epigastrium. Then immerse your fingers gradually during relaxation of the abdominal wall out during patient expiration. The examining hand should slide down to feel the stomach border. Breathe in, breathe out, and palpation. Breathe in, breathe out, and palpation. Identify thickness, consistency, surface, mobility, and pain. The creative curvature is found to either side of the median line 3-4 cm above the umbilicus in male and 1 to 2 in female, in the form of the smooth, soft, not mobile, and painless ridge. Assist a dependent patient in dressing, explain the data obtained during palpation, perform hand hygiene. Discard disposable equipment, napkins in the waste containers according to the sanitarian guide. Record the procedure in medical record as required.